And welcome back to the Family Medicine Rocks podcast here on the Blog Talk Radio Network. My name is Mike Sevilla. And on the line with us, we've been talking about this for a year, and I've been neglecting to get him on the show, so that's my fault. But I do want to welcome to the show my good friend, the president of the Texas Academy of Family Physicians, Dr. Troy Fessinger. Welcome to the show there, my friend. So when you're talking to physicians who, aren't really familiar with it or aren't really buying kind of some of the concepts, what do you say to them about practice transformation and about patient-centered medical home to try to educate them and to try to let them know that this is kind of the model that we should be looking to in primary care and family medicine?
Certainly we hear a lot from members in Texas. Why should I do it? How much is it going to cost? What's the long-term benefit? I think I would say a couple things. Healthcare obviously is changing rapidly. And there's a saying, if you don't like change, you like irrelevance even less. So whether or not patient-centered medical home ends up being the answer that we hope it is, you've got to know that things are changing rapidly and think of how you're going to adapt to it. That's reality. Again, you can love it or hate it. You have to accept it. For the patient-centered medical home, the pushback is often, well, I am a medical home. Well, yes, you are. Why should I have a label for it? Well, if you have a label for it, you get paid for it because insurance companies can quantify it and employers can understand it better. And that's become very real in our market. We believe, the first residency in Texas to be a level 3 recognized PCMH, one of probably the first 2 or 3 in the country. We were the reason that several insurers basically set up PCMH-based bonus contracts for our health system. So we were the carrot. And they simply said, we want that residency practice in the group. And now TransferMed is actually helping our whole employee physician group become PCMHs. But it was the residency and our residency director and his foresight that got that started. So we're actually seeing real money. We're seeing actual bonuses being paid for this. Now you can understand the time sequence. We had to do it first, get the payments later. It did take some upfront investment. It took effort. But I think if you do it well and do it right, it really forces you to examine how your practice really functions on a more detailed level than you probably ever have, whoever you are. And it'll be eye-opening when you really drill down. You're not as good as you think you are. You're not as efficient as you think you are, nor are you as effective as you think you are. Once you get through that sobering stage, you can then get better. And it's really stimulated us to break down hierarchies, break down some traditions, some silos, and really move us further on the road towards being a better practice.
My guest on the line is Dr. Troy Fessinger, the president of the Texas Academy of Family Physicians. And in our closing moments here, I'm going to give you a couple of minutes to get some closing thoughts. And the question I'm going to ask you is pretty simple. I mean, we get this every day as far as, why should family docs be involved in advocacy?
So to answer your question, you can either be at the table or on the menu. So I think if you are frustrated, if you don't like the way things are going, that's the reason to get involved. If you like how things are going, get involved to keep it that way. And a simple example would be I've gotten 3 different state representatives out to visit our residency. My representative, the one that represents the area the clinic's in, and the one that represents the area near our hospital. And one, it was great to get them out there, but they get to see our residency, see what we do, and then when we discuss workforce, they've been there, and they can put a face to it. And I got a very nice letter back from one of the reps saying it was wonderful to come to your clinic. I really love talking to that resident of yours who wants to go to the small town who needs the lower payment program. And that's gold. Because when that vote comes up, he can put a face to it, and he knows why he should vote for loan repayment because he remembers that young resident who wants to go to a small town. So to me, that summarizes why you should get involved in advocacy. You can really move things on a statewide level. Thank you. I'll keep on listening to Radio Free Family Medicine.
Oh, yeah. Oh, man, that is awesome.
That was my title, remember?
That was
You've
your
got a
title.
good one, too. But...
Man, yeah, that is it. Yeah, Radio Free Family Medicine. I love it. Have a great week, and it's going to be great. So thank you so much again.